Depression is something that affects most of us in some way, either directly or somebody that we are close to, either a friend or family member. So today I want to talk a little bit about reframing depression and looking at it as more of a symptom rather than a diagnosis. So the statistics are not great in this country. 13% of the population took antidepressants in the past year, and 19% of people over the age of 60. There has been a 64% increase in the number of prescriptions prescribed just since 2000, between 2000 and 2017. That's huge, and women are 2 times more likely to get prescribed antidepressants than men. So we all kind of know what depression looks like, right? There's just sort of this cluster of things that occur. The DSM-5 describes it, the diagnostic criteria for depression, as 2 weeks with a depressed mood, loss of pleasure, interest in daily activities, changes in sleep, eating, decrease in energy, and a decrease in focus. So that can be pretty broad. Really, though, recently, a lot of functional medicine practitioners and integrative psychiatrists are starting to look at depression as more of a symptom versus a standalone diagnosis. So today I want to talk to you about a few things that we should really evaluate and really look a little deeper at as a society and as a practitioner when people seem to have depression. So 5 of those things that I'm going to talk about today in no particular order are: number 1, thyroid disease. People with even subclinical hypothyroid, that's a low functioning thyroid gland, can mimic symptoms of depression. Once again, fatigue, low energy, changes in sleep patterns, changes in mood. And thyroid is something that does not get deeply evaluated enough. We've talked about this on a few other episodes, and it's something you can look at if you want to look at our episodes on thyroid and Hashimoto's. Another one is hormone imbalance, and I'm talking about other hormones beside thyroid hormone. We're looking at our steroid hormones, the things that our adrenals make to help us adapt to stress, things like cortisol and DHEA, and then also our reproductive hormones, things like testosterone in men and women, as well as estrogen progesterone balance. All of these, if they are off, can lead us to changes in our energy, changes in our mood, things that once again manifest very much like a diagnosis of depression. And then there's nutritional deficiencies, and this is a big one. We need specific nutrients to synthesize these important hormones and neurotransmitters. Things like vitamin D. Vitamin D actually upregulates all of our hormone and neurotransmitter receptors to make them work more effectively. And the majority of our population is vitamin D deficient. Also things like B12 and folate and adequate iron stores are things that should be looked at. And then there's genetic variants, and that's something we really take time to look at here at Sage Integrative, including things like MTHFR, which is probably the most well-known in terms of affecting mood, but also things like COMT, and there's actually even some genetic variants that affect how our body utilizes and metabolizes and synthesizes essential fatty acids like DHEA and choline, DHA and EPA, things that are really, really important for brain health. And then inflammation, and inflammation is huge, right? Inflammation is something that, even in the absence of physical pain, can be a huge, huge trigger in depression, so much so that there's been loads of studies around it recently that look at markers of depression in people who meet diagnostic criteria for depression, and that one of those markers is HSCRP. And what they found is that if they treat people for inflammation who have high levels of HSCRP and bring that number down, the symptoms of depression can be reduced by 50% or greater just by treating inflammation without directly treating the depression. And finally, and this is a big one, is the gut. Gut imbalances create so many issues in our body, and some of those also look like depression because, as we know, and it's very well known, that 90% of our serotonin is made in our gut. So if our gut's not working properly, either to absorb, utilize those really important amino acids and nutrients to make the neurotransmitters, or our gut is inflamed, leading to leaky gut, which leads to leaky brain. Once again, our brain is not going to function right, and our mood can also, once again, seem depressed. If you think there might be something deeper underlying your depression, I really encourage you to find a doctor who can help you dig a little deeper. Go ahead and click on the link below, and we will send you a list of the top 10 lab tests you need done before you accept the diagnosis of depression. If you don't have a doctor or are looking for one who can help you with this, we'd be happy to help as well, and you can reach us at sagemedclinic.com. Thanks for watching.